While those affected by substance use disorders might have strong feelings of guilt or shame, it's important not to reinforce this stigma in our interactions with students. In this video, we will focus on changing the language we use in order to reduce the shame and stigma associated with substance use disorder. We'll work to understand substance use as a universal behavior that can sometimes lead to a substance use disorder. And we'll learn about the role that shame plays in perpetuating these disorders. Throughout human history, people have utilized substances that alter their consciousness, sometimes intentionally in order to enhance alertness or feelings of excitement, relaxation, or well-being, maybe have novel or spiritual experiences, or to reduce discomfort, pain, or anxiety. If you consider your own experiences using substances, you'll begin to realize the truth of this. A morning cup of coffee, a beer while watching the game, a glass of wine with friends, all are forms of substance use that are deemed socially acceptable. Advil, Tylenol, and prescription pain medications are important tools for helping us cope with our physical pain due to illness and injury, and can improve the quality of our lives and even aid in the healing process. For some of us, healthy substance use can shift into substance misuse or a substance use disorder. Sometimes quickly, at other times slowly. As shown by this chart, the process can vary greatly by substance and from person to person. Occasional alcohol use can morph into binge drinking or daily consumption and then into a physical dependency. A prescription pain medication that's important for coping with an injury or surgery, kept in your medicine cabinet to use when you can't sleep, can quickly lead to a physical dependency. Recreational marijuana use can lead to psychological dependency. It's important to note that for adolescents, using any of these substances, even once, is considered misuse and creates a high level of risk for the youth. One common theme for those who realize that they are struggling with a substance use disorder is a feeling of shame or guilt. This can be a result of being physically or emotionally out of control, or poor choices that they have made in relationships with others. Intense feelings of shame, guilt, or fear of stigma can lead people to hide their substance use disorder and avoid seeking treatment. Current treatment methods are effective, and scientists are working to improve our understanding of what works. The best approaches are based on a thorough assessment and tailored to the individual's needs. One known aspect of treatment is that substance use disorder is chronic, and it's common for people to experience multiple relapses before reaching a more stable recovery. What can you do to help? 3 key steps. First, normalize talking about substance use and help students understand what healthy adult use looks like and the dangers of misuse. Research has shown that regular conversations about the dangers of drugs and alcohol can reduce the likelihood of teen use by as much as 42%. Second, emphasize that mistakes around substance use happen sometimes and can be fixed when we recognize them and seek help. Teens who experiment with substances regularly are 65% more likely to develop a substance use disorder than those who hold off using substances until the age of 21, after which the chances of addiction drop to 2%. Third, be careful to utilize terms like substance misuse and substance use disorder when talking about people who are struggling with these issues, and maintain a hopeful attitude. School staff can help combat the shame and stigma associated with substance use disorder by helping youth understand that substance misuse and disorders can happen to anyone, and that shame and stigma can prevent people from getting help. You can further emphasize this by changing the language you use to reduce the shame and stigma of substance use disorders.